Hello, welcome to another great, interesting episode of Focus on Health. Today, being the 26th of March, it is the World Diabetes Day. And diabetes is a world-known silent killer, affecting around 15% of adults aged between 15 to 64 years. And by the year 2030, it will be killing around 24 million people. And that is why we are here with Dr. Podi to just bring into perspective what this is all about. But before we start talking to him, we'll have a look at the day's feature. My name is Olmo Nyango. See you on the other side.
Type 2 diabetes is a chronic illness resulting largely from excess body weight and physical inactivity. Most people living with diabetes in Kenya are diagnosed too late when preventing complications of the disease is no longer possible. Across Kenya, community awareness around diabetes is low. People are often diagnosed through medical outreach camps or when patients arrive at the hospital with complications of diabetes like thirst, vision change, fatigue, and constant hunger. Treatment involves lowering a patient's blood sugar levels through a healthy diet, regular physical activity, and medication when necessary. Reducing the levels of other non-risk factors that can damage blood vessels such as high blood pressure. Over time, diabetes can damage the heart, blood vessels, eyes, kidneys, and nerves, causing chronic problems and early deaths.
We're now joined by Dr. Podi. Dr. Podi, thank you very much for joining us, sir.
Thank you very much for visiting us at Bliss.
Yeah. How's everything?
Well, it's a busy day.
Yeah.
We're having a lot of patients,
Uh-huh.
and it's good that you have come regarding the day, World Diabetes Day.
Yeah.
It's good to educate people about diseases they do not know about.
Yeah. We have so much ground to cover on diabetes. We know it's a silent killer. People are dying. Basically, what is diabetes, Dr.
Before we talk about any disease,
Yeah.
I think it's good you understand what diabetes is
Yes.
and how it will affect us. Diabetes is a clinical syndrome which is characterized by an increase in level of blood sugar, which is also known as hypoglycemia. For every patient, blood sugar varies. Yeah? And for somebody to know if he has high blood sugar or no, there are various symptoms which we will talk about. On the other hand, what causes diabetes? The main reason is that the body is not producing enough insulin,
Yes.
or the cells that produce insulin have been destroyed.
Yeah, so you did mention about hypoglycemia. Then we have then we also have the hypo, and you have the hyper.
Yes.
Then what is the difference between these, and how does it really contribute to one having diabetes?
Okay, hypoglycemia is a reduction in blood glucose.
Yes.
Let's start by saying what's the normal. Now, various doctors say the blood sugar varies from about 3.5 to 6.9 millimoles per liter.
Yes.
Now, below 3.5 is what we call hypoglycemia, and above 6.5 we call hyperglycemia.
Yes.
Now, for a diabetic patient, you have a constant increase in blood sugar, indicating there is hypoglycemia all the time.
And then does that also make it does it in any way contribute to the type of diabetes one can have? And when you're also answering that, you could also tell us about the types of diabetes that one can be able to get.
Yes, diabetes is a very vast topic.
Yeah.
It's divided into many classifications.
Yes.
One of them is diabetes insipidus,
Yes.
which is also known as water diabetes. But I think we should concentrate on diabetes mellitus.
The type 2.
The type 2,
Yes.
exactly. But diabetes mellitus also has 3 types,
Yeah.
and it is about 95% of all diabetes cases. Now, diabetes mellitus is divided into 3, that is type 1, type 2. Type 1 was previously known as insulin dependent.
Yeah.
Type 2 was previously known as the non-insulin dependent diabetes mellitus. And the third type of diabetes mellitus is gestational diabetes, which usually affects
Pregnant women.
Pregnant women.
Yeah.
Yes.
And now, because we know that the type 1 and type 2 are in a way related, and the type 3 is totally different because it affects pregnant women,
Yes.
then what is the difference between type 1 and type 2 diabetes?
As I said, type 1 is insulin dependent,
Yeah.
whereby there is destruction of beta cells. Now, according to physiology, like each organ has a part to play in the body, the pancreas also has a part. It produces insulin
Yes.
from the beta cells. Now, insulin is used to regulate the amount of glucose in our body. How it acts, the excess sugars that are in the body are then stored in the liver, the muscle, and in fatty tissue. So insulin responds by removing sugar from the blood.
Yes.
Now, in cases where there is no insulin, you will find that type 1 diabetes, if there is destruction of pancreas cells, which is mostly found in maybe pancreatitis, that is infection of the pancreas, or cancer of the pancreas.
Yeah.
We have the beta cells are completely destroyed, so no insulin is being produced. While in type 2, which I said is non-insulin dependent,
Yes.
meaning there is insulin which is being produced, it is in insufficient amounts,
Yeah.
and some of the body does not respond to the insulin that is being secreted from the pancreas.
Then moving away from that, coming into the symptoms, we have 3 types of diabetes that we are talking about. What are some of the symptoms? Let's just have an overview of the symptoms that one should look out for when maybe they think or they feel like they may be having diabetes.
Okay, so
Yeah.
for diabetes, I mean, the symptoms are very easy to note.
Yes.
One could be a sore throat, you're feeling thirsty all the time, your water intake has increased maybe up to 4 to 5 liters per day. Because of even taking a lot of water, you have frequent urination, and sometimes with frequent urination there's also glycosuria, which means a lot of glucose is being passed through the urine. Other things could be when you have a small cut wound, it takes a lot of time to heal.
Yes.
Yes.
Yeah.
Those are some of the symptoms.
You talked about glycosuria. Does that in any way also relate to the color of urine one passes?
Yes, it does relate.
Yeah.
You'll find that the urine has a sweet smell. Something
Sweet.
like, yes, something like honey. It could be very turbid, meaning very yellow, and concentrated at the same time.
So what is, just to our viewers out there, what is the correct color that a normal person should pass in terms of urine?
Well, we cannot say what's a normal color,
Yeah.
but urine should be from light amber to clear. Indicates, because the normal water intake for a day should be about 2 to 2.5 liters. Now, depending on how much water you take, the urine will be the color of depending on how much water you take.
And what are some of the causes of diabetes?
Okay, for in today's world,
Yeah.
most of the causes are genetic predisposition and obesity. Other factors is age, smoking also, other diseases such as hypertension, and also some various infections, viral infections and bacterial infections, which affect the pancreas, can also lead to diabetes.
What about inactivity? Some research is saying that having inactivity for a certain time for a certain period of time may make someone to also be predisposed to it.
Actually, it is true. About 50% of the cases are due to diet and physical inactivity. About like as we see, just let me give you a bit statistics.
Yes.
Let's start with Kenya. In Kenya, in the 1980s, we had about a prevalence of 2.4%, which was about 1.6 to 2 million people.
Yes.
Now, 40 years later, we found that the prevalence is 4.7. As you can see, that it has doubled in over 30, 40 years.
And what can this be attributed to, Dr.?
I mean, the same thing we're talking about: diet, physical activity. We are becoming a developing country. Lots of fast foods have come, a lot of inactivity. Youngsters have a lot of stress, and middle age group, they usually don't look after their health.
And also, the race, people of a certain color, let me call them, I don't want to call them black people, okay. People of color, us, people of color. We are more at risk, people, and the Hispanic also are more at risk of having this disease. Yes. And what can this be attributed to again?
Well, it has not yet been proven why certain ethnics have different rates of diabetes. Like in Asia, they say almost 11%, while in the UK, they say about 4% of people have diabetes, while Hispanics, so you can really not relate to why, but it could be maybe the genetic predisposition, while they're saying that if you have diabetes in your family, then you have a very high chance of getting it in your old age.
A very interesting discussion we're having here with Dr. Podi here at the Bliss Medical Center in Westlands. We're now going to take a very short commercial break, and we're going to leave you with the Healthy You segment. When we come back, we're going to talk about the reasons why diabetes is called the silent disease. Don't touch that dial. See you on the other side of the break.
Eight best foods to control diabetes. Number 1, fatty fish. Fatty fish contain omega-3 fats that reduce inflammation and other risk factors for heart disease and stroke. Number 2, leafy greens. Leafy green vegetables are extremely nutritious and low in calories. They are also very low in digestible carbs, which raise your blood sugar levels. Number 3, eggs. Eggs improve risk factors for heart disease, promote good blood sugar control, protect eye health, and keep you feeling full. Number 4, chia seeds. Chia seeds contain high amounts of fiber and low in digestible carbs and may decrease blood pressure and inflammation. Number 5, nuts. Nuts are a healthy addition to a diabetic diet. They are low in digestible carbs and help reduce blood sugar, insulin, and LDL levels. Number 6, broccoli. Broccoli is a low-calorie, low-carb food with high nutrient value. It is loaded with healthy plant compounds that can protect against various diseases. Number 7, squash. Summer and winter squash contain beneficial antioxidants and may help lower blood sugar and insulin levels. Number 8, strawberries. Strawberries are low sugar fruits that have strong anti-inflammatory properties and may help reduce heart disease risk.